Dr. Muhammad Munir. He's a virologist at Lancaster University in the UK. Dr. Munir, pleasure to speak to you. We spoke when this virus was starting a few months ago. Last night, I'm sure you're in the UK, you heard Boris Johnson's Cobra speech. He called it the worst public health crisis for a generation. As a virologist, do you think the measures that he announced go far enough?
Well, not really. I mean, throughout the scientific community here in the UK, we are pretty much surprised to one end that we are seeing the prevailing phase of this outbreak, and we have now witnessed many countries who suffered a lot, not only in other continents, but here in the Europe, which is probably the closest comparison you can make of. So therefore, all the control measures that are currently being put in place, they are certainly insufficient. And that is where we are leaving the space and the weakness in the system, where the chances to get the spread of this infection would be extremely high. And as one of your earlier correspondents were saying, in Cheltenham, the activities are ongoing in terms of public gathering, and when such gatherings are coming, very close contacts are possible, and that is really the major source of spread of the infection.
Dr. Mohammed, as you're speaking, my hair is literally standing on end. You're saying you're surprised by Boris Johnson's measures and that they do not go far enough. I have to say, let me give my opinion. I was shocked yesterday when I heard what he said, comparing to Italy and to what other countries are doing, especially when the chief medical officer said we are just 4 weeks behind Italy. I mean, surely this, I don't know, what more, why are they being so slow?
Well, I think this is really important to understand what is really the trend of this infection and where it would lead to. For example, if you take the number of cases in each country and put into a graphical presentation on day-by-day basis, you will be able to see that all the countries, especially in the Europe, they are following the same trajectory. It's just that some countries are behind than the other countries. And I think it would be really a shame in the scientific community if we do not learn from the bad experiences and the blueprints, for example, in Italian situation, or if we do not learn how the South Korea tackled the situation without having much impact onto the economy and so on. So therefore, I personally believe that the overall actions that are being put in place in the UK is not scientifically backed, and this is something that certainly need to be considered very wisely, and bold decisions need to be taken in a very near future. Otherwise, the consequences would be at the scale where the Italy is, and at that point, if any action need to be done, that would be very costly and would probably be less effective compared to what we would do now.
Dr. Munir, I wish you could speak to Boris Johnson. I really do. Now, can you explain something with regards to the science? Yesterday, I can't remember if it was him or the chief medical officer. Anyway, at that press conference, they said it's not possible to stop everyone getting it, as it's also not desirable because you want some immunity in the population to protect ourselves in the future.
I think this is a completely cruel way of controlling the infections. Let me explain that they are now aiming to achieve a herd immunity. By herd immunity, it means that majority of people in the community, they will be immunized against the infection. So therefore, the people who are not immunized, they would still be protected. To put into the perspective, for example, in the measles disease, if 95 out of 100 people are immunized, the rest 5% will be protected. And those 5% are the one, for example, who cannot be vaccinated because of immune suppression, because of other underlying causes. But that comes with a cost. The cost is that to achieve a herd immunity of 60% in COVID-19, 40 million out of 67 million UK population need to be infected. And this is a massive number. And if that happens, you can estimate the scale of the patients. You can estimate the scale of the cost that is required to immunize the whole nation so that we are protected against. We are talking about almost half of the population to be infected to get the herd immunity, which is
almost half the population, just to be clear, almost half the population to be infected to get the herd immunity. Incredible.
That was right.
It really is what you're saying. It's great to get the science to back up what we heard yesterday from the British Prime Minister. We'll leave it there. Dr. Muhammad Munir, a pleasure, a real pleasure to have your expertise on this news hour. Really appreciate it.